Chris, y'all good? All right. I've called the meeting to order for the special call meeting. Special call meeting 1.01, comprehensive annual financial report. There was a, let me just pull this up. There's a recommended motion from the Committee of the Whole to accept the FY 2020 Comprehensive Annual Report draft as presented for submission to the State Department of Education. Coming from the Committee of the Whole, it needs no second. Is there any discussion? Hearing no discussion, all those in favor, please address by saying aye. Aye. All opposed, and the motion carries. COVID leave. Pull this up. A recommended motion from the Committee of the Whole to establish a district COVID leave program mirroring the COVID leave provision under the CARES Act that expires on December 31st, 2020, effective through August 31st, 2021, and to make this program retroactive to January 4th, 2021. Having it come from the Committee of the Whole, it needs no second. So any questions? Any questions? Hearing no questions, all in favor, please address by saying aye. Aye. All opposed, and the motion carries. 1.03, employee bonus. Recommended motion from the Committee of the Whole to provide a one-time bonus to all active Greenville County school employees of $1,000 and $100 for adjunct personnel in recognition of their extraordinary efforts this year under the perimeters detailed in the attachment and as presented by the administration. Coming from the Committee of the Whole, it needs no second. Any questions? Hearing none, all in favor, please address by saying aye. Aye. All opposed, and the motion carries. COVID-19 update, Dr. Royster.
Thank you, Ms. Levinas-Wells. Today's presentation will be similar in its design and format as to previous presentations. The consistency helps us all to look at this. Presenting it consistently helps us to look at it consistently over time. Having said that, there is inconsistency in here that we believe is largely attributable to the holiday break, both in impact to numbers and how those numbers distribute themselves. For one thing, the reporting during the holiday break was affected in that DHEC on two different days, Christmas Day and New Year's Day, did not do their reporting. So it skews days to a degree. Our real-time reporting was less real-time with us not being in school as it is on a day when we're in session or on a regular weekend. Those are things I think you will see in this. So our incidence data, same thing we've looked at now for a number of weeks. You see now going back to 12/2. Things we look at, the attack rate in GCS. The ones you would have probably not seen because the last time we did the update would be the 12/23, the 12/30, and the 1/6. One of the real inconsistencies in here, as I alluded to earlier, when you look at 12/23, 12/30, and 1/6, you see high, a plummet, then you see a resumption of high. And remember, those last 2-week periods would include those things that happened over the Christmas holidays. So I think that to a degree explains when you go from an attack rate of or a risk rate of 0.23 to 0.58, but the previous week you had 0.43. The attack rate this past week, the concluding week, the 1/6 reporting date, 0.58, it's more consistent with the first part of the month. until we see another week, it'd be hard to know whether you need to look at those as standalone numbers or an average number, but likely an average number. So it's just, again, a little inconsistency there, I think, greatly related to the holidays. Remember, 2 days they didn't make reports. And as you think about the holiday period, the average time from exposure to testing positive to displaying symptoms is 5 days. So as you look through all of these, bear that in mind, 5 days earlier. Likely what you're looking at is 5 days prior to that. So what happened 5 days prior to that? There has been internally among our staff some discussion of how the Christmas holidays might have affected, because that part's purely speculative. Would you be more inclined to go see about yourself and get a test before Christmas or slightly after? So just all things to consider. We can't really know the answers to those. We just have to look at the data as it presents itself and how it trends over time. All right, if you look at this one, it's the one you've normally seen related to the employee quarantine and isolation data. So again, you'll see that isolation quarantine. The top line is that starts to your left as the top line is the total ongoing quarantine. The next to the top line, starting from your left, looking to your right, is isolating ongoing. Then the bottom, the next line down is new quarantines not exposed at school and new quarantines caused by school exposure. Well, generally speaking, when we're out of school, those new quarantines caused by school exposure are even lower than they normally are, and they're normally very low. And you see out there at the end that huge spike in isolating, ongoing, and ongoing quarantine. Some of that is probably summary reporting before we started back. It's hard to tell with 1 week of data. 1 week of data since return. Now, I think this closer look helps you a little bit. And if you're looking from bottom to top, you will see new isolating teacher is the bottom number, the darker blue, but the bottom number consistently across it. The top number, the lighter blue, is the new isolating non-teacher. So you might want to look there to the right and pick up on 1/1, obviously the New Year's Day, and the following Saturday, Sunday, and then looking into the week following out after New Year's Day. You see the number of new isolating. And again, recalling that they did not do a reporting, DHEC didn't. We took reports whenever employees sent them to their supervisor. So you see really a jump there on the 4th. Again, thinking about that 5-day window, I think is helpful in looking at that. Then you see employee quarantine data by day. Again, during the period that we're off, much less meaningful. Coming back, obviously great meaning to that. You see a high there and you see a reduction, a little bit of a bump back up and then a trend back down. Student isolation data, as you see it's the top line, new isolating non-school exposure. Blue is new isolating school exposure. And you generally see none of that during the holidays. Could be some little blips there related to some athletic pursuit, athletic activity. And you see the new isolating extracurricular exposure and the school exposure. Again, the top line, new isolating non-school. The blue line, new isolating school. And the yellow line, new isolating extracurricular, and reading from top down to bottom in the order left to right as described at the base of your diagram. Student quarantine. You'll see a little more erratic pattern there than you see in the student isolation. Again, reading from left to right, bottom to top, new quarantining school exposure, new quarantining extracurricular exposure, new quarantining non-school exposure. You see how those are tracking. A very positive downward trend there within the last week. Student isolation data. And again, you see steady increase. You can really almost see an increase like this going into Christmas. You see a similar repetition going into New Year's Day. And it would appear to a degree to moderate, particularly if you flatten those last four bars. We're well down from the immediate days following New Year's Day. Student quarantine data, you see those same numbers. As you look at that, if you look at the numbers, just at the numbers, new quarantining school exposure is the very bottom number. New quarantining extracurricular exposure is the next number on the individual bar. And new quarantining non-school exposure is the last number. So, for example, on 29, you see the number 23, 13, and 162. 23 being new quarantining school exposure, 13 being new quarantining extracurricular exposure, and the 162 being new quarantining non-school exposure. Again, you see that trailing off. I always like to know what other districts are doing. What are other districts in the state doing? What are other districts around us doing? What are other districts our size doing? Of the 79 regular school districts, 21 are full face-to-face. 21 are full face-to-face, up by 1 from last month. 28 are fully remote, up from 3 from last month. 30 are operating under some form of hybrid schedule. Of the 12 largest districts in the state, which represent about half the state's student population, 3 are full face-to-face, 4 are full remote, and 5 are hybrid. We would fall in the hybrid. What are the districts around us doing? Pickens, Oconee, Anderson, 1, 2, 3, 4, and 5, Spartanburg, 1, 3, 4, 5, 6, and 7, and Abbeville are all face-to-face, full face-to-face. Now, it's helpful to understand that Pickens, while it's full face-to-face, it's not 5 days a week, it's 4, but it's 100% of their students on the 4 days they're there. The others are simply full-on face-to-face 5 days a week. Fully remote, Lawrence 55 and 56, Greenwood 51. Hybrid schedule, Greenville, Spartanburg 2, Greenwood 50, and 52. And I believe 50 has shifted to a virtual. I can confirm that right now. That's the ones right around us. That's the upstate of South Carolina. Always helpful to know what people are saying. Some of this information you've seen before. You see Dr. Bell quoted there. Do not see schools as places for ongoing transmission of disease. It's not evident from our data. You see the assistant state epidemiologist speaking specifically about Greenville County schools. Schools have worked hard to maintain engineer safety controls. In-person learning per se has not been shown to have an increased risk of COVID. It's these other activities that were shown to have an increased risk. She also cited a study from the Centers for Disease Control that examined the behavior of 400 students in Mississippi and found that attending schools where coronavirus precautions were in place, very important to note, precautions were in place, was not associated with infection. From a public health point of view, it's not just about what is going on in schools in person, it's what's going on in the community. You all have seen this. I simply put it in there just for your reference, a statement from Prisma about their guidance to us. Continues over 2 pages. All of you have seen that. Important, I think, to have that in the record. It continues on to a third page. Bon Secours. Bon Secours did not release a public statement, but this is the statement they give to the public when they receive an inquiry. Talking about they've offered medical expertise regarding public health protocols put in place to mitigate the spread of COVID-19, ensure the health and safety of our communities. Heard that Mississippi study already referenced. Students under the age of 19. The causes of COVID-19 children who tested positive were more likely to have attended gatherings, weddings, parties, playdates, or funerals. They weren't more likely to have attended childcare or school in person. Consistent use of face masks and social distancing continues to be important. North Carolina study, Duke University, traced the contacts of North Carolina students infected with COVID-19 in 11 school districts over the first 9 weeks of in-person instruction in fall 2020, representing nearly 100,000 students and employees. Within school infections were extremely rare, according to this study. No cases of in-school child to adult spread were reported. The authors found, again, an important point to look at, that the school's public health measures successfully mitigated spread. A little further away than North Carolina, a study from Iceland. Again, applicable here using contact tracing, and it simply talks about the likelihood of children under 15 to be infected. Again, our concern with all of our students, but particularly our older students, and that bears that out. Qualtrics dashboard, they do not yet have, we have checked with them, some failure on the part of their data manager. They have not entered our data, though we have sent it to them for this reporting period. So if you click on this is kind of the summary of that page. Please note that that's not yet loaded. We will notify you when they have reported back to us that they've loaded our data. But you can see the daily case rate there for employees and case rate for students attending in person. And you can somewhat look at that and look at ours and draw a comparison. Better for us to look at it when it's statistically sound, having been submitted to their system. Simply a reminder of our revised reopening plan framework, indicating that we would use input for the decision we make, including but not limited to DHEC community incidents, GCS internal statistics, ability to appropriately staff facilities, ability to maintain DHEC recommended protocols, monitoring local hospital ICU bed utilization, consultation with state and local public health and medical authorities, data from Qualtrics, and other exigent circumstances. I think we already very much covered this 10-day return and the change that we have made to it, but there it is in summary for your reference. Again, what they're required to do under that 10-day was they can come back day 11 to 14, but remain masked, socially distanced, carefully monitor symptoms. And only about 1% of cases develop on days 11 to 14. The 7-day quarantine that we talked about a little bit earlier, to revisit that briefly, requires a negative COVID test between days 5 and 7, so no sooner than day 5. Appropriate documentation and verification, we established for you the procedure we had on that. At this point, it is available for employees only. Because of the care we take in tracking this and our ability to do so, we do not yet have the ability to expand this to students. And I'm not sure at what point we might have the staffing availability to be able to do that. It is unlikely at this time we can expand this to students. If they're not able to follow that guidance for some reason, which they would need to discuss that with HR, they would have to follow the 10-day quarantine rule. This is simply a reminder, although I do not think that we need one, but it doesn't ever hurt to have one. It doesn't hurt to put one in the record. If we do not follow protocols to minimize close contacts, we expect to see great jumps in students missing school and employees missing work for extended periods of time. And that goes back to the quarantine for identified close contacts. And one of the very important reasons that we are as thorough, as cautious, and as careful and as consistent as we can possibly be in tracking these things. Mitigating staff shortages. We have deployed available district personnel to assist in covering absences at most impacted schools. We use this quarantine reduction, and I think now this ability to further reduce that with the added reassurance that you've taken a test and gotten a negative result. To me, more reassuring than if you simply return after 10 days. We've suspended all semester 2 peer observations for annual and ADA contract teachers unless that teacher's on an improvement plan. That eliminates 200 days that substitutes would otherwise be needed. It also frees adept teacher leaders additionally to serve on call as substitutes. The GATE Alternative Certification Program, we're deferring, not eliminating, but deferring seminars that would take GATE teachers out of the classrooms, eliminating 180 days that would require subs. Other support being provided through virtual sessions and increased support from coaches. Some of those seminars that can't be handled that way will be rescheduled as conditions allow. I think it's important to have clarification on student absences. Students must follow the attendance plan of their enrolled program, virtual or traditional. Parents may keep their children home for up to 10 unexcused absences. Principals have the discretion to excuse additional absences considering hardships or individual circumstances. High school students can participate in e-learning, again requiring the approval at the school level for the principal, because high school teachers will still be providing online either recorded lessons or real-time one-way live stream lessons from their classroom. That is not available at elementary and middle schools. Do not have the ability to do that there because the teachers are teaching face-to-face 5 days a week. That's not, they can't operate a dual platform. We saw how well that did not work and created incredible demands on our teachers. Students not physically present in the building on a scheduled attendance day will be marked absent, whether they're elementary, middle, or high school students. We also have to keep up with them, and that kicks in the requirements for attendance. We're looking at next week, the initial week for our 75% attendance plan. Give a little update to that. Schools are currently preparing instructionally and physically for the transition. On January the 19th, as we previously announced, that new schedule will launch. If we were to see a need to do something other than that, even for a brief period of time, we would make that call and make that announcement no later than Thursday, if we were to see a need to do that. As we continue to get data and hopefully data that helps to smooth out some of those decreases and increases that seem to be able to be explained by the holiday break. Under the new plan, less than 75% of students present on any given day due to the number of students participating in the virtual program. That's just generally true. The daily occupancy of our high school buildings, the daily occupancy will range from 37 to 60% of their ordinary total enrollment. Remediation update. We have been successful, Mr. McCoy and his team, with hiring for the remainder of the year 42 reading interventionists for our elementary school. I think that's huge. We're concerned K through 12 about students' gaps in learning, gaps in instruction, but we are critically concerned at the two ends of the system for two different reasons. Concerned at every level of the system, but especially at the two ends. The end at which the foundation is laid for reading. Okay, 1, 2. Into 3. Those reading interventionists, some are experienced teachers. Many are mid-year graduates. However, we have a highly successful, highly scripted reading remediation intervention that even that inexperienced recent graduate can utilize effectively with our students. The other place that we have critical concern at the other end of our grade span. Obviously, a 9th grader has got to graduate on time. They got 4 years to get those 24 units. One of the reasons trying to get as many as we can safely put in our building. At 75% is based on we're keeping them 6 feet apart or the DHEC approved equivalent 3 feet in plexiglass with a mask. It's one thing we know. Jason's no longer in here. I don't know if he's listening or not. He will certainly reinforce this. And I doubt there's anyone in the room that needs it reinforced because you all have heard it so many times. If you don't stay on track to graduate as a 9th grader, it dramatically increases the likelihood that you will never graduate. So we certainly want to do everything we do, bearing in mind the safety of our employees and our students. And again, while it's important at every grade and every level, it is critically important on the two ends of the grade spectrum that we provide remediation, support, extra help as quickly, as effectively, as efficiently as we can do to build that strong foundation so they do not fall further behind. It is far easier to remediate a student with a sound base in reading in the elementary level and later in middle school if they need some catching up for gaps that may occur if they have that strong foundation in reading. Many of those gaps will be avoided. But I thought that was an important update. At next, either our next or the following COVID update, we're probably going to go into a little more detail about remediation. Vaccination. That is certainly, I think, a bright spot. Had a conference call between DHEC and all the superintendents on January the 7th. As of the 7th, we were in phase 1, which includes school nurses and some of the therapists employed by our schools, whether it's our district or any other district. Occupational therapists, physical therapists, and speech learning pathologists working directly with students. Those qualifying employees have already been notified to contact. When we say this is generic right here, we've already handled that. They've been referred to Prisma. All that's been coordinated and they're moving forward. Classroom teachers, school support staff, and substitutes will be included in phase 1B. We are awaiting further guidance for that. Vaccinations for school personnel will be coordinated. Some of these things were announced on the 7th. Will be coordinated between the local school district and DHEC designated regional provider. Our designated regional provider is Prisma. We have a meeting scheduled, I do, with the appropriately appointed position over there tomorrow morning to further discuss the vaccine process and what sort of tentative timeline we can have to make that available to all of our employees and how we might best help Prisma to get that out as effectively and efficiently as we possibly can to our employees. Now, certainly answer any questions that you might have.
Burke, I had asked that question earlier about the comfort level survey that y'all used to do. Have y'all done one lately of the employees?
We did a survey of high school teachers prior to announcing our planned return. I believe, and if we have not sent you the results of that, we will send them to you. I thought we already had.
Okay. Do y'all do as part of that level survey? Is it morale? Something about morale in there, because I'm getting a lot of emails about the morale in the schools right now.
Well,
is that part of that comfort level?
Well, I think when you see the actual survey, and if I apologize, we not sent that to you. We sent it back to the principals for them to share with all their employees just prior to the break. We'll make sure you have it. I think when you read through it, you'll see that a lot of that certainly goes to employee morale. That is an ongoing challenge. You all recognize that in your action just a few minutes ago. That is a huge challenge to keep morale up among everybody in this school system, at every location, at every level, and in every job, because we are now in almost a year of this. Part of it more intense than others for certain employee groups. There were parts of last spring that were more intense for certain employee groups. But when we came back to school, it was more intense for all employee groups. There is, while the vaccine is good news, like the vaccine is a light at the end of what is a very long tunnel. But there have been issues with the distribution of vaccine. There have been issues about how quickly it's rolling out. Everybody, I think, is operating at their maximum capacity. And I think it is a challenge for all of us to get up every morning, no matter what you do in this organization or any school district in this state or this country right now, and say, man, I'm excited, I'm fired up about getting to work today. That's probably not happening. I think what people are getting up and saying, you know, bad as this is, we're going to push through it. We're going to get to the other side. We're going to do what we need to do. But it seems that we sometimes have just bad news after bad news after bad news. But right now, we're living through the bad news that folks that are experts in this said we would have if we, the community, didn't do what health and medical experts said we should do. But we're living out what that prediction. It's unfortunate. It is demoralizing. That beyond the trying to reaffirm what people are doing, both verbally and by your very tangible action today, I think those are the things we can do about morale. It is an issue.
Okay, is there a plan? I know that you have the plan for the high schools to come back on the 19th. Is there a plan about the transition between classes? I know in the classes they'll have the plexiglass and they'll have the mask, but when they're in those halls, what is the plan for the transition between classes in those high schools?
There are probably 14 plans. I don't know. I assume that Mr. Reimer is still on this Zoom. I'll give you an example of one I'm very familiar with to see if he comes up, or Scott, if you could locate him. For example, at Blue Ridge High School. Now, Blue Ridge High School, one of our smaller high schools, it's also one of our older high schools. It's got 794 students in it. And ordinarily it has, I have that here somewhere. Pull that up real quick. Don't mind. But it's an older design. The hallways are a little bit smaller there. So they have a one-way traffic system throughout their building. So there's no two-way traffic on a hall. Everybody moves one way. All right, they have 794 in their brick and mortar enrollment. They would ordinarily have just over 1,000 students. On the 75% attendance plan, they'll have 596 students there on a daily basis. So that's not quite half the number that would normally be in the hall. Because remember, all the brick and mortar students won't be there every day, only 75% of them. But their solution there is it's a one-way traffic system. Now, Mr. Reimer, there he is, he can give you some more specific examples because he talks directly with the principals. What are you doing? How are you handling this? And or they're saying to him, this is what we're thinking about doing, and getting his input or probably input from other high school principals. I gave the Blue Ridge example. So, Mr. Reimer, you want to give some other examples?
Thank you. A couple of just generic things, and I can answer anything about a specific school. In fact, that was what I was doing downstairs talking to principals. For the most part, arrival and dismissal, there won't be any changes to what they are currently doing. You may know that we're staggering arrivals and staggering dismissals already under the 50% plan. Class changes at most schools aren't going to change based upon what they were doing on the 50% plan. The biggest change that is being made at this point is lunches. I've met with 8 principals so far this week, but there's several that have added a lunch in the attempt to get kids to still be able to eat in the cafeteria as opposed to having to go back to the rooms to eat in the pods with the teachers. Now, I don't believe that all high schools will be able to do that. There will be some high schools that some days students may have to return back to the room to eat, just based upon the cafeteria size and so forth. But the biggest, I guess, adjustment moving from 50%, because you may recall, we had all of these plans for 50%. And really, we overplanned for it, quite frankly, based upon, as Dr. Royster was sharing some of the numbers with you, it was really easier to do because the buildings are so vast that it's really, they haven't reached the capacity of the plans on the 50%, and they believe the same plans will work for 75%. Obviously, there'll be more kids in the building. But lunches are the singular most drastic change going from 50 to 75%, either additional lunches or additional locations for those students to eat their lunches or students having to eat lunches in classroom.
Okay. The concerns that the employees, what I'm hearing that employees are saying is that, okay, we live in the community. The employees, the kids live in the community, and they would bring in what's happening out here in the community. If the virus is high, then I don't want to see that. I mean, I know we've got protocols in place, but with the numbers being high in this community, the employees that I'm hearing from are scared that since we are going ahead with these plans, that people out here in the community is not taking this virus seriously. And that's why it's so high. But I had some questions about the employees that contacted me said that in the teachers that represent them or whatever, that in those meetings or whatever, it's not a two-way communication. It's like this is what we're rolling out and y'all gonna have to deal with it. Have y'all ever thought about having the forum where that it's like a give and take, where that they can speak freely with y'all about what's going on? Because they are asking for, like, if you host an open forum that allow teachers and the community members to ask questions, and that hasn't happened, or is it happening? Have we had that?
I would say, based on the feedback we get when we meet with them and the emails I get, they don't hesitate to say what they're thinking.
Is that still by Zoom? Is that still by Zoom?
The ones we have done prior to the middle school and the high school change have been in person. And in each case, we've had the principal come and bring their teacher of the year, and at the high school, 2 other teachers, middle school, 1 other, because of the room capacity. In fact, coming out of the high school meeting, one of the teachers there suggested that we do that 80% plan. You remember we referred to that? 80%, bring students back in for remediation. So if you didn't, so everybody would get 70%, and those needing remediation would get 80%. Now that plan has more students in the building on any given day. It came out of the group of teachers we met with. I thought that was an excellent idea. I think Mr. Reimer did. People that were in that meeting from up here thought that's a great idea. All right. We said, okay, what do you think about that? The teachers liked that idea. Came from within their group. Now that's more students in the building, and it's more work on the teachers, because they got to not only teach a group on Friday, they got to teach remediation on Friday for those students coming back in.
Okay.
All right, more students, more work. When we calculated based on the failure rates we ran 4 weeks in to the 9 weeks, which were not improved over the first 9 weeks. Now we'll know next week, we'll know how the final for second 9 weeks, what that looks like. We couldn't get all the failures in to ensure all of them 80%. So we said to them, you all preferred this. We preferred this, but it won't work because we can't get them all in here. So we're going to have to fall back to the plan that we presented to you. One of the issues with people suggesting plans is they suggest things that we haven't fully vetted. And that was a lesson right there in that. We hadn't fully vetted that. The plans we come up with, we expect that principals seek the involvement and advice and expertise of their teachers. They bring forward suggestions, ideas, whatever. We incorporate those in. We roll stuff back out as drafts. They provide comment. But when you don't fully vet something, you end up with a plan that has flaws in it. And when you find the flaws and you say, we can't do this, that creates disappointment. The other thing that people often confuse is because we didn't do what you wanted us to do, we didn't listen to what you had to say. One of the things that we said to them, that I said to them, we know we can safely bring more students back into the building and follow the protocols that science, health, and medicine say to us protects people. There's no question about it. You saw some of those studies. And we have this high number of failures. We cannot in good conscience remain where we are, knowing that we can safely bring more students in and realizing that academically they're not performing where they should be and they have social and emotional issues. When we know that we can provide the same level of protection, they have the same protection with 2 days a week as they had with 1. There's fewer students there, but they have this same protection. They will have that same protection on the 75%. Now, I don't know where Dr. Turner went or what he did yesterday. I don't know that. My protection from what he chose to do or not do in the community is this. And what science and medicine and health has says to us is this is the effective protection, because none of us know where the rest of us have gone, who we might have been around, not knowing that they could be asymptomatic and be carrying the virus. We don't know that. The protection is we've established this ability to maintain that distance. Now, it's incumbent on me as an adult, as an employee, to make sure he stays 6 feet away from me, or I stay 6 feet away from him, or I got that mask on if I'm going to pass by him without maintaining that. So we can get input, we can hear suggestions, we can try to address concerns. It's not something we can have people vote on. It's just not.
Okay, do you have a way that they can make suggestions? Or, I mean, they send us emails all the time about these suggestions.
And they send them to us, and we answer them, or we say, well, now here's the part about that you've not thought about, or that maybe didn't occur to you. And if you have some you want us to address, if you'll forward them on, we'll address them. There's not going to be any way to deal with this level of this isn't a national crisis. This is an international crisis. There's no way to deal with this in a way that's going to relieve everyone's concern, that's going to relieve everyone's worry, that's going to make everybody feel as absolutely comfortable as they can possibly feel, or to greatly improve their morale. They should take comfort in the fact that we're doing the things that the experts say we need to do to protect you. That's why we can't bring back more than 75% of them, because we can't maintain the protocols that we know based on not our opinion, not our take on it, but our reading of this research and the recommendation of the experts. That's where we have to be on this. It's not a situation anyone wants to be in, and I don't know what each of you think about this, but I believe I can safely say there is no one seated in this room that is not worried about this, that is not concerned about this, that does not carry this at the forefront of their thoughts a significant amount of the time. I just don't think I could. And I don't feel just like a lot of, I've used this example before. I may have to stop somewhere on the way home to pick something up this afternoon. I see people in stores not doing anything they should do. I don't feel all that comfortable in there, but I'm going to go in there and do my business, and I'm going to keep my 6 feet, and I'm going to wear my mask. And I'm going to get out as soon as I can get out and go on home.
Okay, if I was under the impression that if there was not enough staff to staff, not enough personnel to staff the school, I know you said in here that y'all have people going from the district office. If they are not certified in what it is that those kids are supposed to have in that class, how are you justifying that?
The same way we justify the substitutes we use on a regular basis that are not certified teachers. We have a large number of substitutes that are not certified teachers.
Okay. How
in many cases, when teachers are quarantined, they are continuing to teach remotely from home, and the person simply becomes a person supervising the class.
So if they're sick at home, they're still...
No, not sick at home. No. If they're quarantined at home, and they don't have any symptoms, they're sitting there quarantined. We expect them to work remotely and teach remotely, and they're not charged any kind of leave because they're still working. Now we're having to put a substitute in the room because obviously we can't leave the students in there without them. But that happens. But every day on a regular year, we have uncertified substitutes in the room.
So what about when they're pulling like their counselors and stuff away from their jobs to go into the classrooms. How does that work?
We believe it's more important for them to be able to keep students in school and engaged than doing the things they would ordinarily be doing. We're having to make a choice there, as opposed to shutting down the school and sending everybody home. And we've come very close. We came very close before we got out for Christmas. A couple of those days we hit, I think, 400s of saying we may need to close these two particular schools, because we've reached the point they can't reasonably do it in their school. They can't take everybody out of the office and send them out to a classroom, but they can take a lot of the people out. We can send them some people, but there's a limit to all of that. So we may have to say, shut down. Now, our number of employees out today is, I believe, around 300, a little over 300, 303, something like that. And what happens is every morning, the assistant superintendents, Mr. Reimer, Dr. McDonald, and Ms. Bird, and Dr. Mitchell Hofer, and Ms. Lewis, they get a report. How many teachers are out? They can read. They can go in and look at how many teachers are out, how many subs have been contacted, how many positions are short. They've established the expectation that their principals are going to tell them when they got a problem. But when they see a number that appears to be a problem, then they're reaching out, proactively reaching out to the principal. We need to send people there, then they are coordinating that, I think, primarily with Mr. McCoy and Ms. Hogan, and they send people out. Most of those people, if not all of them, are certified in something. Generally speaking, the people we have available to send from up here are people that are certified in something.
Okay, you had in your presentation about the 10-day attendance plan.
Mm-hmm.
I wanted to ask you if the parents are not comfortable with sending their child in on the attendance plan for the brick and mortar,
Mm-hmm.
Can they still be on that plan but do it e-learning if they are not comfortable with sending their child into the school?
Well, we don't have e-learning K through 8 because our teachers K through 8 are teaching in person every day. At the high school level, whether we're in the plan we're in right now or we shift to 75%, they are either taping or live streaming their class. The teachers are, because every day there's a group that's not there. So at the high school level, they can do that. You can write 10 notes. A parent can write 10 notes to be excused. After that, the principal has to address it. At the elementary level and the middle school level, we don't have a way for you to do that, and we cannot set the expectation for our teachers that you're going to try to teach across two modalities, because we know that doesn't work. It burned them out the first part of the year, and there is not a reason to ask them to do that. For one, you can ask them to go to the virtual school, and although we have a waiting list right now, it's only a waiting list from K through 8 because they haven't had time to process their assignment. That'll be cleared off sometime this week. Now, if somebody requests on Thursday and we clear it off on Wednesday, it could sit there for a day or so. We have enough capacity for them to shift K through 8 over to virtual.
Okay, so say for instance, the high school, would they be taken off of that list for them to be in the traditional school if they are not comfortable with coming in now?
But
if the numbers go down, they want to come in?
At high school,
taken off that list? How would that work?
At high school, they can, with the absences approved by the principal above the 10, they can do e-learning, but they're not going to get anything other than what the teacher does live every day or records for the students that are not present.
Okay, so they'll have the videos available to them, but they would.
But it is nowhere near the level, because we need to be honest about it. It's nowhere near the level they would get if they were in the virtual program. And I think we've got a little bit of a waiting list at high school that generally, Mr. Reimer, has to do with some course or two that we can't get for them.
In referring to going from brick and mortar to virtual, yes, sir, that's correct. There are some situations because of the specificity of the course that was offered brick and mortar, but was not offered in virtual. So if the child were to move to virtual, that class isn't available virtual. But that goes back to what Dr. Royster said originally. When we get into those situations, principals are trying to troubleshoot that, problem solve that for their kids. So it may be possible in that situation that they would remain in the brick and mortar class for that one class and e-learn while not at its optimum, and then move to virtual for the other courses.
Because isn't it still the case that if they're not in traditional, they can't play the sports?
You mean virtual school?
And if they are in virtual school, they are not allowed to be part of the sports, right? So
No,
they
ma'am.
have to be traditional.
No, ma'am. They can play sports in virtual or traditional.
Oh, okay.
As long as they're a full-time student with us. ROTC.
They're virtual. We would show them as a virtual student, but they might come in person.
Okay, since the students can do that, but never mind. I know the teachers can't do that because they are on a certain list, whether they're virtual or whether they're brick and mortar.
No,
the students can do that.
We've been able to accommodate some teachers as well
that are not comfortable with being there in person, but once they get comfortable, they can come back and be in person.
There's a process. Yeah, no. That's right. That's right.
Sorry, there has to be a medical reason that either relates to them as an individual or a family member with a medical reason or some other great hardship. Not simply the fact they're not comfortable being there. No, ma'am, we're not able to accommodate that.
So if it's mental, that wouldn't be considered medical. If they mentally are not prepared, anxiety of being in that space, that wouldn't count. It has to be medical.
Well, if they have emotional issues related to their ability to come to work, that needs to be documented by a medical professional.
Okay. All right. That's all I have.
All right, Dr. Royster, if we could just talk briefly through a couple of these things. And I think Ms. Goodwin-Carl is asking the same questions, but I just want to make sure before I repeat it that I understood it correctly. So right now, if a parent emailed me today and said, the numbers are spiking, and I don't want my kid to be back in school face-to-face, they could, according to this, for the next 10 days, school days, keep their kid at home.
It was simply a parent note.
Right.
Assuming they've not done that 10 times already this year. Yes, sir.
Could you repeat that question?
So right now, if a parent calls me today and says, the numbers are spiking, I'm not comfortable, I think we should take 2 weeks, take a 2-week break and let everything get back to normal. A parent right now could keep their kid at home for 10 days and have no penalty taken against them with the attendance plan.
Now, we have no way to provide instruction for that student. Okay. We would not expect teachers to provide special plans or work for them, and we don't have that dual platform going.
But the typical kind of attendance policies don't apply. They can still graduate, they can still move on if they miss these 10 days.
Graduation, when you get to the high school level, see, that's a different story because they do have the ability to get the material the teacher is recording or live streaming. But at high school, it comes down to they got to be passing that Carnegie unit. The way even in ordinary times, the way the statute is written, it gives great discretion to a principal to utilize their judgment regarding excused absences.
So if they miss their 10 days, because the second sentence on slide 29 says, principals have the discretion to excuse additional absences considering hardships or individual circumstances. Mm-hmm. So parent calls me today and says, I'm out for 10 days because I want things to cool down. And then they come back in March and they actually have the need to isolate or to quarantine, then am I reading this correctly, that that's a discussion they could have with their principal, and on a case-by-case basis, the principal would have the ability to look at that situation and say whether to excuse those additional days if they need to.
Now, you gave one example there. If you were to have to isolate, then you're out medically. There is a trigger for a certain number of absence medically when you be put on homebound.
Okay. But if I'm using these 10 days as a preventative measure, and then I come back and actually have to use another period of time to meet the district's policy for isolation or quarantining, really probably is more correct, then you're saying that the individual school principal has the authority to work with parents on that issue.
Yes.
The other questions I have are about the statement from Prism on page 17, on slide 17. So I know we really struggled with getting them to just come out and say, yep, we met with superintendent and we fully support this plan. So they released these statements. And one of their statements says, essentially, as long as the following things are done, we believe that these are safe practices. And so a couple of them though strike me as important. So one is strict adherence to masking. So now that we are returning to school face-to-face 5 days a week, are you comfortable saying that our schools are following a strict adherence to masking?
Yes, based on our understanding in looking at all the advice we get, where DHEC says what we ought to do, where Prisma says what they recommend we do, what Bon Secours says we recommend what we should do. You might get advice that from some individual medical person who might say, well, I think you should wear a mask all the time. That's not the consensus, and that doesn't fully align with the DHEC recommendations.
Right, but I guess what I'm asking is, in the beginning, we at least as I talked to staff, particularly at the high school level, we were not quite as vigilant about requiring a mask to be worn all the time when you're in the hallway or whatever. We asked them to, but if you've got to remind the same 15-year-old to wear his mask every time he's in the hallway, then are we giving guidance to our schools that in order to ensure strict adherence to masking, that we're going to have to be able to hold them accountable for that, hold students accountable for that policy?
Yes, sir. Using your example, if I have to remind you of something a couple of times, that's one thing. If you're the same guy that comes down past my door every day, second period, not wearing your mask, that's a different thing. We have, in fact, sent students to virtual school because they didn't comply with what we told them to. But it has to be addressed by the person at that point. And we will support what they do. One of the things that we did on the middle school return, we sent a letter to every parent, every household, and they had to read that and agree, that we understand these are the rules that we're supposed to follow and what could be the consequences of not following them. Because that was a suggestion, going back to the meetings with teachers, that was a suggestion from some of the teachers. They felt like that would be helpful. So we may need to reiterate with the high school level, they can't just come do what they want to when they're not 6 feet apart. For example, Mr. Reimer shared earlier, I don't think he said it a while ago when he's talking about different arrangements in the schools. He shared with me, I believe it's Riverside High School, who had worked out as part of their plan, they got some dots on the floor in the hall. And at lunchtime, you can sit on that dot in the floor outside the door in the hall and eat your lunch, and they are at least 6 feet apart. But only a certain number of people can go out there, and you can sit there without your mask on as long as you stay on the dot. I mean, that sounds kind of like something that you might generally do in the 3rd or 4th grade, but they got a point of reference.
Sure.
It's a reminder. Just like when you walk up to that counter out front, those stickers on the floor are a reminder to all of us, well, you need to stand on that sticker. Don't go stand right up next to that person in front of them. So, and they're doing all kind of things like that, but we need to make sure that everybody understands this is what you got to do to stay safe. And no one should hesitate to address that, because the reason for it is to make sure you're safe. So you should have an inherent desire to do that, and we need to reinforce your authority to do so.
Okay. So I know that I think we were copied on several emails that came to you from majority Malden teachers.
Mm-hmm.
As I've corresponded back and forth with them, one of the things that I'm hearing from schools to school is some variation about distance. So when we look at the sample classroom, we see pods of students sitting with plexiglass, and we see those pods separated from each other in an appropriate distance, so you could wear your mask and remain 3 feet apart from the people in the other pods. But it's a reality that our schools are already overcrowded. I mean, we're moving thousands of students from one school to another over the next couple of years because our schools are already overcrowded. So if a teacher comes into their classroom and they see a setup in their classroom that has students not 3 feet apart from each other, what recourse does that teacher have to address that situation?
They need to immediately talk to the principal about it, because when they're taken down there and they're set up, I don't know where Mr. Davey was in here. He spearheads that along with Mr. Carlin and Mr. Knotts at the warehouse. They set them up in accord with the specifications. Now, why anybody would go in there and move them after the fact, don't know, but that could happen. They need to immediately bring it to the attention of the principal, and if it's not resolved, they need to let us know. We had a complaint just last week from a particular teacher in a particular school that they were not where they were supposed to be, and we sent, actually Mr. Davey went out to check on it and follow up on it. So we'll address that. And it might be helpful, we'll send this to you. I have a chart here that shows how many would ordinarily be in a school. For example, at Malden, you mentioned that example. In the 75% plan, Malden would have 1,251 students in their building. In an ordinary circumstance, they would have 2,386. So they're right at half. That's 52%. I'll send you that because it might be helpful for you all to see that. Because again, sometimes people's perception when they're talking to you and that reality tends to be two different things.
Thank you.
Is that it? Ms. Doolin?
My question is about the student isolation data chart.
Sorry, about the student,
Isolation
yes, ma'am.
chart. It's mostly orange, which is students isolated from exposures outside of school, with very little green ones and no red ones this month. I wondered how you know that children are isolating from school exposure on dates like January 3rd, which I think is when they had been out for 2 weeks, and December 30th, December 26th, because that was all over winter break.
They would have had the people that do this charting of this work, which the student data charting all passes back through Ms. Loggie's office, and she may still be on here. They would have some information that would cause them to tie that back to the school. They got some specific information. I don't know if she's still, Janet, are you still on the call?
Yes, sir, I'm here.
Could you speak more directly to that? You may not have heard that.
Can you just review that?
Yes. When you mark a student as being isolating related to exposure at school, how do you know that is the case? How do you determine, categorize it that way?
On our questionnaire, we asked specific questions about infectious period. And infectious period is 2 days before symptoms appear and 2 days before the date of the test for an asymptomatic positive case. And then we determine if the student was in the school setting during those times. The school setting meaning in school or participating in school activities, extracurricular.
Well, I think I'm confused then how that could be the case when these were over winter break.
Can you speak to that? Can you speak to that part, Janet? Or
Yes, I can. We've had basketball tournaments over the break. We've had different school activities going on during the break, and there have been exposures to other students during those activities.
Which to me should be categorized in extracurricular exposure. I think we need to follow up on that. They completed these charts today as we were meeting because our data is running behind due to the holiday and some of the DHEC reporting. And quite honestly, both of our systems crashed yesterday. So they did this data report as we were meeting this morning. So we'll follow up on that and either correct it or find the answer to your question.
Okay, my other question about this also, I asked it last month as well, is what age groups are these students in? Are most of the students that are exposed at school, high school versus elementary school? So that's sort of what I meant by it last month, and I still have that question now.
I don't know that we keep it in such a way that we can readily graph that, but we will check on that and see. We keep it, a lot of this is because of the way we need to keep it for our purposes. So we'll have all the elementary, but we have them by school. We'll have all the middle, but we'll have them by school. And one would think that it would be easy to sort and analyze some of this data, but it's not as easy as I thought it would be. I'll have to tell you that.
Well, but just looking over the past 2 weeks or 3 weeks, it looks like there's 1, 2, 3, 4, 5, 6 students that were exposed at school or possibly exposed at an activity. So I can't imagine it would be that hard to find out how old those 6 students are.
Anything else?
No, that's it.
So you're going to get, Ms. Doolin, that information, Dr. Royster?
Yes, and we'll see what it takes to track that. Because again, anyway, the resources we have with which to do this are limited, and we're now, the reason our system crashed twice yesterday is because we believe the number of people that have access to rights to sort data in it, and if they all start sorting at the same time, some of you may work in these, you must work in it, Lisa. If all of us can access it to sort data and we all start, and 5 of us start sorting data at the same time, it crashed the system. So as we've added reporting to it or yesterday's crash had to do with changing the quarantine period because we had to add people with an ability to sort data in the system, and it crashed it 2 times. We didn't get it back on till sometime in the middle of the night last night. So it is back on now, and it seems to have worked all day today based on the number of reports I see coming in and going back out. Now, to make sure everybody understands, because I wouldn't want anybody to leave this either listening to it or participating in it, it does not affect the guidance we give to a school. So if you submitted a form when our system crashed, you were told, keep that person at home. So that default guidance went to anybody that submitted a form. So crashing the system had to do with us being able to track all the data and sort it to provide all these reports. and for our operational purposes on a daily basis.
All right, thank you. Ms. Wells. I have no microphone. I didn't have one. I think that's a sign for us to finish.
Thank you. So I think we have all been answering a lot of email and trying to respond to a lot of people. And I will say I know there's a lot of fear and frustration in the community because they don't understand everything that's going into these decisions and they don't have any control over it. So that breeds the, kind of the fear and the frustration. So what I want to kind of make sure I understand is when we have parents that are concerned or students that are concerned about going back into the classroom, how can we address that? So before I kind of run through that and make sure I have all that right, I want to talk a minute about the incidence data. Because what I routinely point back to is, how we've evaluated this data and the way that we've come up with, the attack rate and then done the comparison so we can look at what the risk ratio is. Even within that, I guess my question would be, is there a point, so outside of just concern with teachers being able to take care of the class and being able to be in the class, outside of that, is there a point at which we don't use that risk ratio as our marker and we look instead at all those things we talked about before? It's in the guidance, right? We, as the board, we said that you would look at we had a whole list of items you would consider. So I want reassurance, and then I want to be able to pass that reassurance along to the community that we are watching the incidence rate in addition to our risk ratio, and that we are, if we see at some point that the rates, they're always going to be lower in our schools, right? Because to your point, we're doing a great job with protocols to limit exposure, but there's still in that transition, in people transporting back and forth in the carpools or however they're getting there, there's the potential for risk. So do we have a point at which we would say rate of spread is so high, we're going to go to e-learning? Do we have that right now? Is that in our psyche? Are we?
We've always said that those risk rates, looking at them, if we start approximating one, that's really concerning. Approximate one locally, that's extremely concerning. It's concerning right now that we're approximating one with the state. We're pull it back up. It's not the highest point it's been. I think it's at 0.91, and we have hit 0.92.
Right, that's right.
So we're looking at that. Again, when you look at the week before and you look at that risk rate, the risk ratio and attack rate, it was substantially lower. To your point, lower on a high number, but really low. That point, I think it's 0.23 to the county.
So you were awesome.
I don't know.
Our concern in looking at that 2 weeks, that it went so low that 1 week, and now it's back up to that number that we had leading into Christmas. We've still not exceeded that, but it's back toward that number. That's concerning. I mentioned to you earlier, if we decided that we felt like we might need to pause expanding what we're doing, we would do that by Thursday. One thing is we'd like more clarity on what that means. Should we be looking at that as an average of those 2 weeks or not? And right now we don't have enough numbers, because you all might have seen this. Yesterday, DHEC posted statewide numbers and they asterisked those numbers and said, due to some issue, those numbers were not the accurate numbers for that day. Didn't elaborate. I think it inferred they perhaps were lower than they actually were. So we're curious to see today, how is that corrected over today and tomorrow and leading into Thursday? So there's not a hard point. We know when we hit a hole number one, we're equal risk. We don't ever want to be at equal risk with the county, but we need to be very cautious that we're at equal risk at the state. It might cause us to pause something for a period of time. It might cause us to look differently at places where we have more movement rather than less movement.
Well, and I guess, so if you look at the incidence rate, the 2-week incidence rate, our rate now is higher than the Greenville County rate from the beginning of December, right? So we're at 931.9. So again, we're always going to be less than Greenville County because we're able to get compliance when we have control. But our numbers are still going up,
Yes.
even within the school setting.
And one thing that we looked at and that you see in this, and again, we're really making this report real time. As I said, they compiled it this morning. You start to see some tailing off in our numbers. I think you see that in some of those graphs.
Yeah, that's true. So versus the 2-week rate, which is extremely high.
Yeah. So look at your 1.5, 1.6, 1.7, and 1.8 new isolations. They begin to approximate 12.16 and 12.17. Obviously, higher than where we'd like them to be, to 0. But we need to see another day or two of trend to that direction. Hopefully that means that as we believe being in the system, 7, depending on who you are and what you're doing and how you get there and how you get home, between 7.5 and 9 hours a day, going to cause our numbers from within to go down.
So your feeling is, even though if you look at the 2-week incidence rate, that's extremely high, even within Greenville County schools, because we have that data that shows we got a pretty steep decline.
We seem to be on a trending decline based on, I guess y'all probably know, based on these numbers.
Okay. So given that, we still do have a lot of people who, and there's a lot of fear, there's a lot of frustration, there's a lot of, people take something out of words, they take something out of a soundbite and make it into something that it's not. But what I want to be able to articulate clearly, and I want us as the full board to do, because several board members have spoken to it, is understand what options parents have. So they had an option at the beginning of the year. They had an option to kind of get on a list to go one way or the other.
Mm-hmm.
It sounds like in K-8, they still have an option if they are in person, they're doing face-to-face, they have an option to go back to virtual school, potentially, and get into virtual school, right?
Yes, we've got the numbers we have on this waiting list now. We have more seats than we have on the waiting list. It just takes them, they have to process it. Right. It just takes a while to do it.
Right. Okay, so that's one option. If they're afraid they don't want to go to school, they can go to virtual. They can do that. The other option that I heard us talk about was the ability of a principal to excuse absences beyond the 10. They using their own discretion. So if they have a conversation with a parent and there's a lot of angst with the child, with the parent, then principal has the discretion to make that change. And then what I've heard you say, in addition to that, if they were out over an extended period of time, if it reached a certain point, then they could actually be assigned to a homebound situation.
Now that's if they're in medical quarantine. That was in response to Mr. Lewis's scenario about medical quarantine. We would consider that that's a medical reason to be out of school, and the homebound rules kick in.
Okay, so they would get support in that way. Have we had conversations with the State Department about, because we do have attendance guidelines, we have things that are in place, and we have truancy laws, right? So have they given us any guidance about what that flexibility looks like outside of what we already have in our policy and what we have said, even on our website to parents?
There would be nothing in what they have discussed with Ken Arnold, who leads our attendance and social work group, that would be restricting in any way to what we've described to you today.
So they recognize again, these are unprecedented times. And our principals understand that they have that latitude within our current practices to approve those excused absences and can work with each family on an individual basis.
And I think they would, I'm going to describe it perhaps a little differently than they might describe it. I think they would be concerned about issues of educational neglect at the state level and regarding guidance to us, but not truancy. If that, now that's me putting a label on it, not them.
So I guess to that point, you know, when I was a little girl, my dad had church conferences, his minister, he'd take me out of school for 4 days. We'd tell the teacher, she'd give me this great packet in a manila envelope and say, okay, here, take this, do it while you're gone, and then come back. That is sort of what we were talking about in elementary. If you're staying in school, but you feel like you can't be in the classroom, I think what I heard you say was they could have work to do, but they can't have the expectation that a teacher can provide e-learning.
They can certainly provide them copies of what they're doing in the class, but we don't expect teachers to create different lessons or to provide tutoring or that sort of thing for this choice. And that's something that we believe and know that the principals would share with them. Look, if you're making this choice, you're really kind of saying to us, you're going to help your child do this on your own, because we can get you in virtual school. Right now, we can get you in virtual school.
Those are the two options that are available to a parent in elementary school in particular. If they have a fear that they really just feel like they can't do.
High school is pretty easy. You just follow the recorded information.
Yeah,
it's
so
just different.
Has seat time been waived this year?
Yes. Yes.
I thought we talked about that. Okay. Okay. That's helpful. Thank you.
Ms. Mosley.
Thank you. I'll try to make this quick. Dr. Royster, clearly you are trying to satisfy a lot of different people, thousands who all have different risk tolerances. It's probably the best way of saying it. My risk tolerance is very different than some in this room. Can we get data on the quarantine? Because it seems to be, I've noticed in all of your COVID updates that our quarantine numbers, with maybe the exception of this one, but they seem to, well, the student one definitely, but the quarantine seems to very much exceed the isolation numbers. And I would just be curious to know if these folks that are quarantining and having to stay out, these students, in fact, are, well, and frankly, the teachers, now that we have the new quarantine protocols, I'm a little more encouraged about them getting back into the classroom sooner. But how many of these folks are actually testing positive later? I'm just curious.
And I don't know, we can probably get that. We'll see if we can't easily get that. Right. But it really goes back to
I just wondered if that would bring an extra level of comfort that we are seeing, even though we have this vast, because this looks intimidating when you see all these folks out. But then when you see, if there was data that said,
just anecdotally,
anecdotally,
because our isolation is so far lower than that, it would cause you to believe that. Yes. See if we can get something more anecdotal.
Well, and I guess I'm just wondering if that would help bring a little bit of comfort, because I do believe that there is a misunderstanding in our world, my opinion, that exposure is imminently, it means infection. And I don't know
No.
So I just think that might be helpful. To address, well, Michelle brought up a point about the classroom changes in high school. Correct me if I'm wrong. If the students are masked and they only have 5 minutes to get from point A to point B, that is well within the 15-minute distancing or whatever proximity. So we really should be okay in almost any school, really, whether it's a one-way hallway or not, right?
There's another mitigating factor as well. Not only do they fit their mask, and if you total up the time, the 7-period day schools, you might hit 15 minutes. But that would sort of presume we're all going to move the same way, coming from and going to the same places, which, as you all know, that's not correct.
Right.
Because you go in a room first period, you get up and you go take your one-way trip or however you go. You get to your second period, there may be no one in the second period, or there might be 5 people in there that were in your first period. Then when you get up and move again, not going to travel with the same group. So between the shortened time, the masking, and the fact you're constantly mixing the people, you're statistically, your likelihood is driven further down by both of those factors.
And that's a good point. I hadn't thought about the same class, but I really was thinking it more from a distancing standpoint, since that seemed to be a concern. And I think to address the community's concern about, or their question about, why do we believe that they're more safe in school when they're out when they're bringing the community into the school? Well, my understanding and the logic behind this, and what you're saying the health professionals are supporting, is that if they're sitting in our classrooms for 6-7 hours a day, some cases longer if they're staying for tutoring or whatever, or athletics or whatever, and we're diligently following these protocols, as we obviously seem to be for the most part. They're not at the mall. They're not having lunch with their friends, especially these high schoolers that can drive and meet up. I happened to see a study group the other day. I mean, truthfully, they were studying, but they were at Panera, and they could have, I was actually encouraged to see that they were doing their work together and all that. But at the same time, that's reality, and they're out in the community, and they're in that regard. So I guess I'm just making sure that I say that out loud, because I do think folks are maybe not thinking through what, especially our older students, their socialization needs are. And so when they're not at school socializing, they are finding those opportunities out elsewhere. Mm-hmm. So, okay, just making sure I'm hearing that. Derek asked my question about virtual to high school. So it sounds like there's no wait list. And
now there is, be clear on the high
small wait list.
There are some classes, they're just having trouble getting them scheduled.
Right. And then, hold on. Okay, I know I keep asking this question, and Jeff, I'm sorry, because it's going to go back to this live stream taping question again that I've already asked you 12 times. Did I hear you say that should, and maybe it's Dr. Royster, whichever one, did I hear you say that even on the 2-day schedule we're on now, which at this point is almost moot, that teachers should be taping and or live streaming every day for every class? I mean, or...
It should be for, as long as there's kids at home, remotely at home, yes, they should be taping or live streaming. I think Ryan are still on the call. I cannot remember the date that was published for the principals for that, to compare the teachers.
But I mean, that's going forward.
It is already passed. It is in effect. I don't remember the specific date. No, sir.
I don't know if that's happening or not. I'm just going to put that out there, but I'll double check.
And that would be good again for us to know, because as they report those to us, we follow up with the principal and say, it's been reported this person or this group is not doing this, so please make sure that's happening.
Well, and please understand, I'm not trying to tattle. I'm just trying to understand what the expectation is, and then because as a parent, I'm trying to manage my child's expectation. I'm also trying to manage what they're telling me. I'm also trying to make sure what my kids are telling me is true. I mean,
right.
And please understand.
We invest.
Yeah. Okay.
We do investigate that, though, Ms. Mosley, because, like you said, in some cases it's true and in some cases not. So we want to make sure it's happening.
Right. And then the last thing, I've been very transparent. I'm not on the same page as every single teacher that has contacted me with their concerns. I mean, with every single concern they have. But one concern I have seen repeatedly that I just want to question, and only because I don't know that I fully understand. I think there seems to be some anxiety and or frustration around the seating, moving to the 75% plan. I've actually had teachers, because just like a lot of us have had teachers contact us who are not happy about going back into the classroom with more students. I've had as many or more teachers contact me and say, please please be our voice that we want more. And some are even saying we would rather have 5 days every day norm, whatever norm, you know what I mean, typical, that have to manage this 75%, particularly where the seating chart is concerned. And I guess because I don't understand the seating chart, I don't know how to respond to that. So does that question?
I'm not 100% sure I understand the seating chart piece, unless they're talking about the plexiglass.
I think they're trying to say that the 75% requires some kind of seating chart management that it's just burdensome.
So as to make sure we can accurately contact trace, we need to know where they're sitting in the class. But you should do that once. I mean,
okay.
And
I just wasn't sure if this was an everyday thing or what. I wasn't understanding what their.
It shouldn't be every day that you have, you let the kids come in and sit where they want, and then you have to figure out where they're sitting. It should be you create almost like when we were in school. Your teacher gave you a seat.
Okay.
And so while that may be a throwback to tradition, we would say in this pandemic, you need to create a seating chart for your kids, knowing that you're going to have multiple seating charts because, of course, different kids each day.
Okay.
But yes.
That seems to be a source of anxiety for some. I'm just trying
well,
to.
Well, that may be the teacher that says, well, you can sit wherever you want to every day.
Maybe. Okay.
Now, there's still some traditionalists that, well, now you might get to pick your seat, but you stay there.
Okay. And then last but not least, I did hear you say what you said about lunch. I'm grateful that it sounds like we are trying to allow lunch to still be somewhat of a social period as best we can. Because right now, I mean, I'll be honest, that's one of the highlights of my child's day, just because she gets to see a friend. And so is that what I'm hearing, is that most of the high schools are trying to accommodate a lunchroom scenario versus a classroom, eat lunch at your desk behind plexiglass scenario?
That's probably more for Scott to address, but kind of consistent with the middle schools and the elementary. They've tried to, even if they had to eat in the room, so they've tried to rotate that or mix it up so it looked a little bit different.
Okay, I just want to know what expectations.
I could simply speak to Riverside because they had shared that with me this morning. I'm sure they're doing some innovative things other places because I too enjoy lunchtime.
Okay, well, just know, even though I don't fully embrace every single thing about the plan, I do recognize how difficult it is, and I do recognize that you can't make everyone happy. So, thank you.
Thank you, Ms. Mosley. Dr. Royce, I'm just going to run through a couple of things very quickly. Elementary through middle, principals have the discretion to excuse additional absences, considering hardships or individual circumstances if that parent exceeds the 10 days. And also it would be if that parent or parents decide that they want to keep their kids out a few days out of the week because they're afraid of the high increase in the community, that it's up to those parents to make sure it's okay with the principal or the teacher to give them the materials, and that the principal has discretion.
Anything like that somebody's planning not to be at school, they need to have that discussion with the principal.
With the principal. And then it's up to the principal. They have the discretion to approve those absences, correct?
Yes, they do.
All right. Also, I think a lot of concern with people right now is I don't think they understand that we're seeing the numbers of the students in the schools, and they're seeing the numbers where the community is experiencing a high increase in COVID numbers. And there is a major difference between those two. Am I correct? The increase in the community numbers and the increase with student numbers, this is the way.
Yes, there's always a distance, but they've both done like this.
Yeah.
Now, what we have begun to already see, when you look back through that presentation, you'll see some individual days now where they're coming down.
Is there any way, I know this would take work, but is there any way we could put that on the district website where parents can see how this is going so they don't think that is that you praying right there? Please don't give me
No.
another thing to do.
Well, I mean, see, it's or it.
So
Not the graph, but the
not
numerical
the graph,
representation.
but the way it shows.
Comparison to the
Yeah, let's get this on because I got
comparison to the DHEC numbers specifically showing our community spread per 100,000 versus DHEC community spread per 100,000. It shows our risk ratio. It is on the website. There are lots of parents who look at it, I promise you, because it was a little bit late because we were running behind in numbers and we heard from all of them. So it is on there and is updated every Friday.
because I think that's important. I think there's so much confusion with what they're seeing on TV and what's actually happening in the schools. So thank you, Terry. And I hope all these parents that are listening will get that word out to others.
We'll also look at that and see if there is a more clear way to present it. Because some of this, you got all this information.
I know.
It becomes, instead of providing clarity, it provides confusion.
Okay. Well, I certainly don't want to cause more confusion because
No, that's my point. If we could
my
find a
phone
more
caused
clear
confusion.
way to present it, I think it would help eliminate that confusion.
Okay, and then also, is there any way? Well, I don't think we can create a tool that monitors in-person school infection rates and compare that to community spread. I don't think we can do that. That's what we were just talking about. Okay, well, let's do that because that takes care of two of those questions. And the only other thing, I think a lot of students in middle school, I don't know a lot, there's students in middle school that test the waters by not wearing their mask or rebelling not to, and the teachers don't feel like they have the support of the administration because then there's a backlash from the parents coming down on the schools. You know, I don't care that my kid's not wearing a face mask, but I think it's getting to be a little, it's a game. It's a game. I'll just put it that way.
We simply need to know where that is believed to be occurring, and we'll address that with the principal.
Okay. And then I'm going to say thank you. That's what I'm going to say. Thank you.
Thank you.
Thank you for clarifying. Thank you for the discretion to help these parents in elementary and middle. And I'm going to ask one more question. I don't know, I must have board member on my head when I go out in the public, but there was a family that said they contacted the school that they are zoned for. And of course, their children didn't get in there after Christmas, so they've put them at OLR. But they said that particular school has already said, well, they're not going to get in next year either. And I said, that's not true. This is only for this year. Is that correct? These people can't, we're not making a determination for.
You're talking about to their zone to attend this area of school?
Yeah. We're not.
Well, unless this catastrophe continues on, surely to goodness it will not continue on in the next fall.
I know, but
we hope we'll be back in a normal operating mode next fall. The answer to that is you go enroll and they let you in.
But see, they opted out to virtual, the beginning of the year.
That's just for this year.
They weren't able to get in. And so they're not automatically going to have to do virtual because they opt out this year. It starts over, right?
In fact, I think we're asking people right now, would they like to go to virtual next year?
Well, these people
because we know we'll have some people that want to continue in virtual.
Yeah.
So we're actually asking people that are in there now, I guess everybody, would you?
We're taking the assumption that everybody is going back to their normal attendance.
Okay, good. That's what.
They can opt starting at the 15th, they can opt into virtual for next year.
But if they don't, they can go brick and mortar.
Our default is you're going back where you came from. You need to tell us if you want to go to virtual Because we got a plan for virtual, just like we got a plan to open Fountain Inn High School and staff it.